There is still time left to enroll in the 2025 Marketplace plans. Enrollment in Marketplace plans lasts through January 15th in most states. But don't get overwhelmed by Healthcare.gov. It can certainly be confusing. So today we're going to walk you through how to use Healthcare.gov so that way you can pick the best Marketplace plan for your needs. So this really is the beginner's guide for using Healthcare.gov. This is, of course, Healthcare.gov. The first thing I want to show you is you would either log in if you already have your account, or we can just browse plans and costs, which is what we're going to do today. The first thing it's going to ask you is your zip code, because of course the prices and plans available are determined by your zip code, but that's not the only reason. I'm actually going to put in a New York zip code because I want to show you something. Your state's marketplace is New York State of Health. Visit NY State of Health. So if you are enrolled in a plan through a state that does not use Healthcare.gov, not to worry, you can still go to Healthcare.gov and then it will simply redirect you. So now let's put in a zip code for a state that does use Healthcare.gov. For example, Florida. We're going to put in some quick information. Now, you can skip these and see the full price plans. These questions that it's asking you are to determine your eligibility for premium tax credits. It's going to ask you about your age, your household size, your current income, etc. If there are any changes throughout the year, then it's very important that you come back to log in and make those changes. That's what we saw. I'm going back here. Log in to make changes. That's what we saw over here. Because if there are changes, you may be eligible for a special enrollment period, which means you could actually change plans, or it may change the size of your premium tax credit. Now, why is that important? Well, because a premium tax credit is just a tax credit that is paid upfront. So if you estimate your income as too much and you end up making less, then you could be eligible for a larger premium tax credit. If you estimate your income as too little, then you may actually have to pay some of that premium tax credit back. So it's important that you keep this information accurate because you don't want a surprise when you go to file your taxes. Anyway, if you had your plan ID, you would put that in from previous years, but we're going to skip that. So we're going to put that it's us and other people in our household. Continue. Are you married? Let's put yes. Continue. Will you claim any dependents on your federal tax return? We're going to put yes. This, of course, doesn't count us or our spouse. Let's put 2. Continue. Now it's going to ask us questions about ourselves. It's going to ask our age, but that is not relevant with regards to our eligibility for a premium tax credit, unless, of course, you are eligible for Medicare based on your age, which you would then click down here. So let's put we are a 35-year-old male, eligible for health coverage through a job, Medicare, Medicaid, or CHIP. Why would you click this? Well, if you are eligible, that would affect your eligibility for a premium tax credit. For example, if you're eligible for Medicare or through healthcare through your job, then you're not going to be eligible for a premium tax credit. Legal parent of a guardian or child under 19, claimed as tax dependent. We're putting that because we already put it. Pregnant, don't include baby as a dependent until it's born. Why is this important? Well, because you may be eligible for pregnancy Medicaid based on your income and if you are pregnant. And tobacco users, there are special programs, some tobacco cessation programs. Let's continue. Now we're going to put our spouse. Let's put that our spouse is also a 35-year-old female, and they're also that legal parent. Continue. Now we're going to put our dependents. Let's put a 5-year-old male, eligible for health coverage. We're not putting that. Legal parent, no. Pregnant, no. Tobacco user, no. So we click none of these. Continue. And we'll put that our second child is, I guess we have 5-year-old twins. None of these. Continue. So then it's going to ask you to confirm your household members. If you need to make any changes, you would click edit, 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 or you can even add a dependent if you need to, but we're going to click confirm. What do you think your household income will be in 2025? This is very, very important. As I said, your income is directly tied to your eligibility for those premium tax credits. Premium tax credits are just a tax credit that is paid upfront for those who are eligible based on their income and enrollment in a marketplace plan. You'll see these premium tax credits reflected in a significantly discounted monthly premium, which we will see in just a minute. How to estimate your 2025 income. It is looking at your MAGI, which is Modified Adjusted gross income. For most people, it is going to be pretty much identical to their AGI, your adjusted gross income, which is what is going to be on your taxes. The only difficult thing here is that it's difficult to estimate your income for the upcoming year, especially if you're somebody who's self-employed, if you are a seasonal worker, a gig worker, anything like that. It's really difficult to estimate your income. So if you are noticing that there is a change in what you estimated versus what is actually happening in reality, please come back, log into your account, and make that modification. So we are going to put in that our household income, because it does include your dependents. If your dependents, have any type of income, it does include that as well. Your household income, let's put that it's going to be $80,000. That is sort of the median household income in the United States. Continue. So based on this, you will likely be eligible for a premium tax credit of $1,281 per month. That means that when you see your premium tax credits in just a minute, you would see the actual price minus the $1,281 premium tax credit. Now, if we put in a higher income, 150, not 15, then you would have a lower eligibility for a premium tax credit. Even higher, and a lower premium tax credit. Now, on the flip side, let's say we had a lower household income. It's basically breaking it down into adults and children. What it's saying is that for the adults, you would be eligible for a premium tax credit of $931 per month. And your children would be covered through Medicaid or CHIP, which is the Children's Health Insurance Program. I'm going to split the difference here because I want to talk about the silver premium tax credit. Okay. Also, this is important. You may be eligible for extra savings if you pick a silver plan. So in addition to that premium tax credit, you may be eligible for extra savings with a silver plan. Basically, there are metal tiers on the marketplace, which I'm going to show you right now. Okay. Let's look at these filters so that I can explain. There are bronze level plans, silver level plans, gold level plans, and platinum level plans. Now, are platinum plans the best? Do they offer you the most benefits and the best doctors? No. Are bronze plans the worst and they offer you no benefits and the smallest networks? No. These metal tiers have nothing to do with the quality of the plans themselves. It only has to do with the cost sharing structure. So, health insurance plans in general have what's known as cost sharing. So they're either copays, which are fixed amounts, like it could be $15 to go see your regular PCP or primary care physician. It could be $50 for a specialist. It could be $250 to go to the emergency room, etc. Coinsurance is a variable amount. So it is a percentage of the cost. So bronze level plans, the cost sharing structure for the coinsurance is a 60-40 split, which means your insurance provider will cover 60% of the bill and you will cover 40%. Silver, it's a 70-30 split. Gold, it's an 80-20 split. And platinum, it is a 90-10. However, with these extra savings, if you're eligible for extra savings on a silver plan, then actually your copays and coinsurance may be low enough that they actually offer you a better coinsurance, a better cost share than even a platinum plan. You will notice that generally speaking, bronze level plans tend to have lower monthly premiums, and those monthly premiums get higher and higher as we approach platinum plans because the insurance carrier has to make up that money somewhere. However, if you're eligible for those extra savings with the silver plan, you will have lower monthly premiums because we're talking about silver and bronze as opposed to gold and platinum, and you have extra savings on the actual coinsurance. Okay, let's get out of here for a minute. So right now we're looking at all the plans available to us in the zip code that we put in. Here's what I was talking about with the premium tax credit. So this plan was, and this is for our whole family, this is not per person, $1,283.14. That was for the whole family per month. But with our premium tax credit applied, there actually is no monthly premium for us. And right now it is sorting by lowest monthly premium. You could also sort by lowest deductible. Okay, so this plan has a $0 deductible. What does that mean? Well, that means that you don't have to meet any sort of out-of-pocket spending before your insurance begins to contribute to the cost share. So, let's say you needed to be hospitalized right away. Well, then what kind of plan is this? Okay, bronze. So then right away you have a 40% coinsurance as opposed to having to pay the full amount until you reach your deductible. Then it has an out-of-pocket maximum. The out-of-pocket maximum for this plan is $18,400. That is your family out-of-pocket maximum, and we're going to talk more about that in just a minute. Let's go back to sorting by lowest monthly premium. Now, a super brief pause here. If you're liking this video, and I really hope that you are, please make sure to click like and subscribe as well to stay up to date. We do release these videos on a weekly basis, and we expect that there are going to be some major changes to healthcare and health insurance in this country in the coming years. So please make sure to subscribe to stay up to date so that way you can stay ahead of it. Also, if you have any questions whatsoever, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers and we're licensed nationwide, and there is absolutely no charge for our services. So you absolutely do not have to do this all by yourself. All right, let's get back to it. Now let's go back to these filters and take another look. Okay, so you can filter by monthly premiums. If, for example, you know that the maximum that you can pay on a monthly basis for your entire family is $750, you could put that at the top of the range. You could only look at silver plans if you wanted to take advantage of those extra savings. You can also, over here, filter by PPO, EPO, and HMO. So what is the difference? So a PPO plan will offer you the most flexibility. You can go in and out of network, so the cost to go out of network will of course be more expensive, but if you need to see a provider that is out of network, you have that flexibility. And you do not need a PCP, you do not need a referral to see a specialist. So really it's going to give you tremendous flexibility. An HMO will have the least amount of flexibility. You will need a PCP, you will need a referral to see a specialist, and you will only have coverage in-network except in the case of a true medical emergency. Then EPOs sort of split the difference. So you really only have coverage in-network except in the case of a true medical emergency. However, you don't need a referral to see a specialist. Then over here, you can look into plans that are eligible for an HSA, which is a health savings account. These types of interest-bearing accounts are only available in conjunction with an HDHP, which is a high deductible health plan. So it's just that. It's a plan that's going to have a much, much higher deductible. And very often you'll see that the deductible is actually the same as an out-of-pocket maximum. These plans are best for people who are really interested in that HSA and taking advantage of that triple tax advantage. The amount that you contribute to your HSA is pre-tax. The accounts themselves are interest-bearing, and that interest is not taxed. They roll over from year to year. It is, in fact, your money. It stays there as long as you withdraw it for a qualified medical expense. There is no taxation or penalty. And, of course, you can actually invest a certain portion of this account, and any earnings on those investments are not taxed. Now, as I said, this HSA health savings account rolls over from year to year, and if you hold on to it until you turn 65, you can convert it to a basic retirement account. Let's apply these filters. So right now we are looking at 64 plans based on the filters that we put in. Right now it is still filtering based on lowest monthly premium. Now, since what I'm seeing here is $201 for the lowest monthly premium and we're only looking at silver plans, I'm guessing that means that any of those $0 monthly premium plans were probably just bronze plans. But $200 for a family is pretty darn reasonable. Your deductible here is $14,650, and your out-of-pocket maximum is $14,070. Not a huge difference. So there is a considerable spending, health and drug combined, to reach that deductible. Now, of course, many services are covered even prior to meeting the deductible, and it says so here. So like primary care, no charge for a visit from day one. So you haven't met your deductible, but there's no charge. Specialist, oh, there's no charge for a specialist. That's interesting. Urgent care, it is a $90 visit. So if you have to go to the urgent care, you don't have to meet this deductible. Emergency room, 50% coinsurance after deductible. Outpatient, $25. Generic drugs, $40 copay after deductible. Oh, that's interesting. Wow, that's pretty high. You have to meet your deductible before you get any prescription drugs. That doesn't sound like a great plan. I would certainly want to investigate that further based on that. Something I did forget to mention, of course, if you already know your prescriptions and your doctors, make sure to put that information in, because then you will see if your prescriptions are covered and how much they will cost. And of course, if your doctor is in network, and that's very important, especially if we're looking at an HMO or really just anything, because you don't want to have your primary care be out of network if at all possible. Let's take a look at this plan. Very similar. My Blue Silver. Interesting. These are almost identical. Continuing to scroll down, a $6,000 deductible. This is more like it. Generic drugs, $20, no mention of a deductible. That's more like it. It's really kind of unreasonable that you would have to meet this deductible before having any prescription drug coverage. That seems quite insane. All right, now once you've narrowed down your plans based on the filters that you've put in, something that you may want to do is compare a couple plans. So let's compare this plan, which I don't think I like based on that prescription drug coverage. This plan, let's see if there's anything else that we want to compare that's also looks, pretty different. Actually, let me scroll down. I want to see if there's, here we go, a much lower deductible plan. I want to compare this one also. Okay, you can compare up to 3 plans. And then it's going to give you a quick snapshot. We'll look more in depth in just a minute. All right, so estimated monthly premium, I would say they're pretty comparable, 201 on the lowest end, 264, so that's not a huge difference. Deductible, that's a huge difference. No deductible for this. That's pretty impressive. We'll talk more about this family deductible versus the individual deductible and the family versus individual out-of-pocket maximum in just a minute. Let's see. They're all HMOs. Star ratings, that's pretty self-explanatory. Plan documents, we're going to look at these in just a minute. Costs for medical care. These are just some of your basic costs that you want to look at. So deductible, they're all HMOs, so we're only talking about in-network coverage. We've already compared the deductibles. Out-of-pocket maximum, pretty comparable. Primary care, no charge per visit, $40, $55 from day one. Okay, so now I'm seeing where they're sort of making up this cost. And this has multiple tiers of in-network. So that's something else that you would have to look into, because, you may think that your PCP is in-network and there's no charge. However, they could be a tier 2, which is sort of confusing. Specialists, again, I'm seeing where they're sort of making things up. No charge, $80, $110. That's not such a huge difference. Let's see. X-rays and diagnostic, $65, period. 40% coinsurance after deductible, 50%. So this would likely be your least expensive option. When we're talking about coinsurance or something like X-rays, they can get pretty expensive. And that's the difficulty with coinsurance, is that, you just see 50%, but you don't know what that actual cost is going to be, because you need to know what the X-ray actually costs. Lab outpatient, $20, 40% after deductible. Oh, I don't like this plan. 50% outpatient, 50% coinsurance after deductible. That's pretty reasonable when we're talking about outpatient care already. 40% coinsurance after deductible, that's fine. Outpatient professional services. It's all this after deductible that I don't like for this plan. Routine eye exam. Okay, prescription drug coverage. So medications will be divided further into different, basically, tiers of medication, and the cost is determined by the tier and your plan. So there's generic, preferred brand, non-preferred brand, and specialty drug. Generally speaking, these will be your most expensive option. So generic drugs, this was the one, that $40 copay after deductible. That is crazy to me. $20, period, that's reasonable. $35. They're on the more expensive side for a generic drug. And honestly, you might be able to get a generic drug much cheaper by not even utilizing your insurance in this case. There's pharmaceutical assistance programs, state pharmaceutical assistance programs, coupon programs like GoodRx. So always compare that with your insurance as well. Once we get to the brand drugs, then, you're likely to see less expensive options with your insurance. All this after deductible, no good. $40 for a preferred brand. Okay, whoa, $200 for a preferred brand. That is a huge difference there. So this is why it's very important to put in your prescription drugs, because this would tell you whether they're covered and what they're considered. Let's see. Non-preferred brand drugs, $80 copay after deductible, 50%. That's okay. $350 copay after deductible. Yikes, 50%. You can see the full list of covered drugs here. Access to doctors and hospitals, because it's, these are all HMOs. Interesting. I thought these were HMOs, but you don't need a referral to see a specialist. That's sort of unusual. Urgent care in hospitals. This breaks down the cost of that, which we've, sort of already looked at. So these are the 3 examples they always give. Typical cost for a healthy pregnancy and normal delivery. Typical yearly cost for managing type 2 diabetes for one person. Typical cost for treatment of a simple fracture. I don't know how helpful these are to compare, and they're, somewhat comparable. The only thing I could say, is very helpful is if you're planning on becoming pregnant, it is helpful to look at this one to determine, if your plan is going to be on the more expensive side or on the less expensive side. And of course, if you have type 2 diabetes, this is helpful. Obviously, you can't plan for whether or not you have a fracture, so I don't know how helpful that is. Some plans will offer dental coverage or child dental coverage, and then there's all these medical management programs, additional benefits that may or may not be available, as well as these other services that may or may not be available to you. Now, let's say one of these plans really was of interest to us. I'm going to take a look at this plan here, the one with no deductible. Let's see where the summary of benefits is. That's what I want to look at. Okay. This is going to go more in depth, basically, of that information that we were just looking at. Prior authorization may be required. That's pretty common with an HMO. If you do need any type of more extensive diagnostic tests, you need prior authorization, you need a referral from your PCP, etc. You may have to pay for services that aren't preventative. Oh, that's also very important. We've covered this in other videos, is that very often services will be covered entirely, especially with no copay, when they are considered preventative, but the second they become diagnostic, then there can be a hefty charge associated. And that's the difficulty, is that you go in for preventative care and all of a sudden it can become diagnostic and there's really nothing you can do. For example, you're unconscious during a colonoscopy, which is considered preventative. But as soon as they find something while you are unconscious, it becomes diagnostic. So it's not really like you have the moment to object to anything. Not that you would object to anything. You would want it to be diagnosed. But that is the unfortunate thing, is that many plans cover things when they're preventative and there's a significant charge when they are considered diagnostic. So always make sure you read your bills carefully. So this is going to just go into further detail regarding the plans, the benefits offered, and the costs. Something else I want to look at, the plan brochure. Oh, right. I did want to talk about the individual versus the family deductible and the individual versus the family out-of-pocket maximum. This is actually there to help you if you have a larger family. So this plan actually had a $0 deductible that we were looking at, but let's say it didn't. Let's say it actually had one of these deductibles. Let's look over here at the gold. So the individual deductible was $1,500 versus the family deductible is $3,000. Okay, so let's say there are 5 people in your family. Let's say you have not spent a dime on your healthcare this year, but each of the 4, let's say, okay, so then your mother has spent $1,000, your father has spent $1,000, and your sister has spent $1,000. Well, you haven't spent anything, but that's $3,000. That's the family deductible has now been met. So nobody has met their individual deductible, but that family deductible has now been met. That means that your insurance will now begin to contribute to the cost share for all of you. Even though not a single person met the individual deductible, the family deductible has been met. And it's the same for the out-of-pocket maximum. Now, the out-of-pocket maximum is there, of course, to protect you from major medical bills. So it works in the same way, even if you haven't met your individual out-of-pocket maximum, but the family out-of-pocket maximum has been met, then that means that there will be no bills for anyone in your family for covered in-network services for the remainder of the calendar year. So it is there to help you. The out-of-pocket maximum is there to help you. And of course, that individual versus family deductible and out-of-pocket maximum is there to help you. Now a reminder, as you saw earlier in the video, some states actually do have their own individual marketplace websites as opposed to Healthcare.gov, and oftentimes those states will have slightly different enrollment periods. Now they are going to be slightly different. Usually they're still going to be in that November, December, January window. It's not like they're looking to enroll you in April, but they could be slightly different, so please be aware of that. And also, you may qualify for a special enrollment period. Special enrollment period eligibility is determined by qualifying life events. Generally speaking, qualifying life events to make you eligible for a special enrollment period break down into 3 categories: changes in household size, changes in residence, or loss of health coverage. So change in household size is you got married, so there's somebody new, had a baby, adopted a child, that's someone new, got divorced or legally separated, so you lost somebody, or death of somebody in your plan. So that would also make you eligible for a special enrollment period. Then there's changes in residence. That's pretty self-explanatory. If you move, then you would be eligible for a special enrollment period, as long as it's in a new zip code, of course. And loss of health coverage. So if you had health insurance through your employer, then you are terminated from your position, you quit, etc., that would qualify you for a special enrollment period. Please remember, though, that if you have COBRA coverage, terminating the COBRA coverage does not qualify you for a special enrollment period. Also, in attempting to enroll in Medicaid and denial or losing Medicaid would also make you eligible for a special enrollment period. And then there are other qualifying changes as well. For example, becoming a U.S. citizen, leaving incarceration, or even something like a natural disaster which has displaced you in some way. As always, as I mentioned earlier, you absolutely do not have to do this alone. And of course, we recommend that you don't. You can work with a broker. Usually a broker will not have any additional fees. Some do. However, we do not charge our clients any additional fee. So if you would like our assistance, you can reach us in the comments below or at the number on the screen. And of course, if you would like to learn more about some of those other options other than Healthcare.gov, make sure to check out this video over here as well, in addition to our marketplace playlist. As always, please make sure to like and subscribe, and we'll see you next time. Bye-bye.